You love your cat. You feed her. You pet her. You think you're doing everything right. But what if the things you do every single day, the habits you don't even think about, the shortcuts that feel convenient, are quietly destroying her kidneys from the inside out? Kidney disease is the silent killer of cats. It's not flashy like cancer. It doesn't announce itself like an infection. It just sits there, working in the darkness, stealing your cat's health one day at a time. And here's the heartbreaking part. Most of it is completely preventable. I've talked to vets who see this every week. Cats coming in, looking tired, losing weight, drinking more water. And by the time the owners realize something's wrong, the kidneys have already lost 75% of their function. The vet says there's nothing left to do but manage the decline. But it didn't have to be this way. Today, I'm going to walk you through 10 mistakes that destroy your cat's kidneys. These are things happening right now, in your home, that you probably have no idea are causing damage. Some of them will shock you. By the time we hit mistake number 4, you're going to put your cat's food bowl down and make a change immediately. Let's get into it. Mistake 1. Feeding dry food as the only diet. This is where everything starts, and it's the biggest mistake almost every cat owner is making without realizing how serious it is. Cats evolved as desert hunters. In the wild, they get almost all their water from their prey. A mouse is about 70% water. A bird is similar. Cats' kidneys were designed by nature to work with this kind of diet. They were never supposed to be dehydrated. But then we gave them dry kibble. Dry kibble is about 10% water, maybe less. And we started giving it to them as their only food, 3 meals a day, every single day. Think about what that's doing to your cat's body. Her kidneys are working overtime to extract moisture from food that barely has any moisture in it. Day after day, year after year, her kidneys are straining just to keep her body hydrated. It's like asking someone to run a marathon every single day on barely any water. Eventually, the body breaks down. Researchers have found that cats fed exclusively on dry food consistently show higher levels of dehydration at the cellular level compared to cats that eat wet food. And here's what's crazy. The owners of those cats have no idea it's happening. Their cat looks fine on the outside, but on the inside, the kidneys are getting progressively weaker. The fix isn't complicated. It's not expensive. You need to add wet food into your cat's diet. Real wet food. Pâté, chunks in gravy, anything that has significant moisture content. Even just mixing some into the dry kibble changes everything. Your cat's kidneys start getting hydrated again. The workload decreases. And within a few weeks, you'll notice your cat acting more energetic, more playful, more like herself. Mistake 2. Using the wrong litter box. I know this sounds weird. What does litter have to do with kidneys? Everything. Most people use clay litter, silica dust litter. These litters break down into tiny particles that become airborne every single time your cat uses the box. Your cat breathes that dust in every day, multiple times a day, and those particles travel directly to her respiratory system and into her bloodstream. Here's what happens next. Those particles trigger inflammation, not just in the lungs, but throughout the body. And inflammation is poison for kidneys. Chronic inflammation forces the kidneys to work harder to manage it. They're spending energy fighting inflammation instead of doing what they're supposed to do, filtering waste. A study out of UC Davis looked at cats with chronic kidney disease. The researchers found that cats using dust-producing litters had significantly higher inflammatory markers in their blood compared to cats using dust-free litters. The inflammation was chronic, it was constant, and it was accelerating kidney decline. Switch to a dust-free litter, paper-based litter, corn-based litter, even pine pellets. Anything that doesn't create a cloud of particles every time your cat digs. Your cat's lungs will feel better. Her whole body will experience less inflammation, and her kidneys will finally get a break from fighting an invisible battle. Mistake 3. Ignoring dental disease. This one connects to kidneys in a way most cat owners never suspect, but your vet knows about it. They just don't always explain it clearly. Look in your cat's mouth right now. I mean, really look. Check the back teeth. Look at the gum line. Do you see buildup? Yellow or brown crust along where the gum meets the tooth. That buildup is tartar. And underneath that tartar is a thriving colony of bacteria. Every single day, those bacteria are doing damage. When your cat chews, eats, even just swallows, those bacteria get pushed into the bloodstream. and the immune system has to fight them off. But here's where it gets serious. Those bacteria don't just disappear. They travel through the bloodstream and they find the kidneys. The tiny blood vessels in the kidneys become infected. The tissue around those vessels gets inflamed, and slowly, over months and years, that inflammation destroys the kidney tissue. Veterinarians have known about this link for a long time. Periodontal disease and kidney disease go together, but most cat owners never make the connection because the problems show up in different parts of the body. Start brushing your cat's teeth. I know it sounds impossible. Most people think cats won't let them do it. But if you start early and do it gently, most cats will tolerate it. Even just 3 times a week makes an enormous difference. And if brushing is completely off the table, use dental treats. Give her toys designed to clean teeth. Do something. Because every day you wait, bacteria are quietly making their way to your cat's kidneys. Mistake 4. Using scented litter and air fresheners. Here's something that blows most people's minds when they realize it. The scent in your cat's litter box and the air fresheners around your home are toxic for her kidneys. Think about your cat's sense of smell. It's incredibly powerful, about 14 times more sensitive than yours. When you light a scented candle or spray air freshener, you're not just creating a pleasant smell, you're overwhelming your cat's sensory system with chemicals. Those chemicals, phthalates, artificial fragrances, volatile organic compounds, they all need to be processed by the body. And guess which organ is responsible for filtering out chemical waste? The kidneys. Every time you spray something in your home, you're asking your cat's kidneys to work harder, to filter out compounds they were never designed to handle. Over time, this chemical load adds up. The kidneys get exhausted, they start to fail. Switch to unscented litter. Open a window instead of using air freshener. If you absolutely need something to smell nice, use a small bowl of baking soda. That's it. No chemicals, no fragrance, just a cleaner environment that won't stress your cat's kidneys. Mistake 5. Not providing enough water sources. This is so simple, but almost nobody does it right. Cats are picky about water. Most cats don't like still water sitting in a bowl. They prefer moving water, running water. It's instinctual from their wild ancestors. Running water is cleaner, fresher, less likely to contain parasites. So when you put a bowl of water on the floor next to the food, your cat ignores it. She drinks way less than she should, and her kidneys start working on reserve, trying to conserve water because there isn't enough coming in. Get a cat water fountain. Seriously, this one thing changes everything. Cats drink more from fountains, a lot more. Some cats will triple their water intake just because the water is moving. But here's the thing. Get a fountain that's easy to clean. A lot of fountains have tiny crevices where bacteria grow. You end up creating another bacteria source that stresses the kidneys instead of helping them. Get one with smooth surfaces. Clean it every other day. Fill it with fresh, filtered water. And don't stop there. Put multiple water bowls around your house. Some cats like water near their food. Others prefer it far away from where they eat. Have options. The more your cat drinks, the more her kidneys can do their job properly. Hydration is literally the difference between kidney disease and kidney health. Mistake 6. Feeding low-quality commercial cat food. Most cat food is garbage. I know that's harsh, but it's true. Look at the ingredient list on your cat's food. What's the first ingredient? If it's a grain, if it's a filler, if you can't even pronounce it, that's the problem. Cats are obligate carnivores. That means they need meat. High-quality meat. Their entire digestive system evolved to process meat, not corn and wheat and mystery byproducts. When you feed them low-quality food, their body spends extra energy trying to digest it, and that extra energy demand puts stress on the kidneys. But it gets worse. A lot of cheap cat food is loaded with magnesium and phosphorus. These minerals are necessary in small amounts, but in excess, they create the perfect conditions for kidney stone formation. Kidney stones don't just cause pain, they block the filters your cat depends on to stay alive. They cause infection, they cause permanent scarring. And here's what makes my blood boil. Most people are feeding this cheap food because they don't know better. They see the commercials on TV, they see the colorful bags on the shelf, they think their cat is eating well. But the reality is that food is slowly destroying her kidneys. Spend more on better food. Look for meat as the first ingredient. Look for minimal fillers. Your vet can recommend specific brands. Yes, it costs more. But compare that to kidney disease treatment, dialysis, medications, vet visits. Suddenly, spending a few extra dollars on good food seems pretty smart. Mistake 7. Giving your cat medications without checking interactions. This one catches so many people off guard because they're trying to help. Your cat is older, she gets arthritis, so the vet gives her pain medication. Or maybe she gets a urinary tract infection and the vet prescribes antibiotics. These feel like normal, necessary medicines. What could be wrong? The problem is that a lot of medications stress the kidneys. NSAIDs, which include ibuprofen and many arthritis medications, can cause kidney damage over time. Antibiotics need to be processed by the kidneys. Even some common medications meant to help can end up hurting if they're not managed carefully. And here's the dangerous part. A lot of owners give their cats multiple medications, and nobody's really checking if those medications work together or if they're putting too much stress on the kidneys. It's a recipe for disaster. Before your cat takes any new medication, ask your vet directly. Will this stress her kidneys? How long will she be on this? Are there alternatives that are gentler? Make sure your vet is monitoring kidney function with blood tests. Don't just assume everything is fine. Mistake 8. Allowing repeated urinary tract infections. A cat gets a urinary tract infection. You notice her straining in the litter box, acting uncomfortable. You take her to the vet. The vet gives antibiotics. The infection clears up. You think the problem is solved. But then it happens again. 3 months later, another infection. Then another one 6 months after that. Each time a urinary tract infection happens, it causes inflammation in the urinary tract and kidneys. And each time that happens, a little bit of scarring occurs. The tissue gets damaged. Over time, those repeated infections create permanent damage that destroys kidney function. Some cats are prone to these infections. Maybe they're not drinking enough. Maybe they're holding their urine too long. Whatever the reason, if your cat keeps getting infections, you need to figure out why and fix it. Not just treat each infection as it comes up. Is she drinking enough water? Try the fountain. Is she holding her urine too long? Make sure litter boxes are accessible and clean. Are there other health issues contributing? Ask your vet to do a thorough workup. Stop the pattern instead of just treating the symptoms. Mistake 9. Letting your cat get dehydrated in heat. Cats hate heat. Most cats will find the coolest spot in the house and just lay there when it's hot outside. And they drink less water when the weather is warm. That's the problem. Heat plus reduced water intake equals serious kidney stress. Your cat's kidneys need consistent hydration to function. When the temperature rises and your cat drinks less, her kidneys have to work with very little fluid. That's when problems happen. Kidney stones form more easily. Infections develop. The kidneys can't filter properly. During hot months, you need to be extra vigilant about getting water into your cat. Make sure that fountain is filled. Put ice cubes in her water bowl. Some cats will drink more if the water is cold. Offer her wet food more often. Keep your home at a reasonable temperature. Use fans. Use air conditioning. And watch for signs of heat stress. A cat that's panting, that's drooling, that's acting lethargic. These are emergency signs. Get her to a vet immediately. Heat stroke can cause acute kidney failure in hours, not days. Mistake 10. Ignoring early warning signs. This is the last mistake, but maybe the most important one, because this is where you can actually save your cat's life. Kidney disease is silent. Your cat won't complain until it's almost too late. But there are early warning signs if you pay attention. Is she drinking more water than usual? Is she eating less? Has her weight changed? Is her breath different? Does it smell weird or medicinal? Is she hiding more than normal? Is her litter box behavior changing? These are all early signs that something is wrong with the kidneys. And the crucial thing to understand is that if you catch kidney disease early, you can slow it down. You can give your cat years of good quality life. But if you wait until she's obviously sick, you're years too late. Get blood work done regularly. Once a year if your cat is young and healthy. Twice a year if she's older or if she has any risk factors. A simple blood test shows kidney function. It shows early problems before they become big problems. Don't wait for your cat to tell you something's wrong. By the time a cat shows obvious symptoms of kidney disease, the damage is already catastrophic. Your cat's kidneys are working silently right now. Filtering, cleaning, maintaining the balance that keeps every other system in her body running. She doesn't complain. She doesn't ask for help. But you can help her. You can protect her. The dried food in her bowl. The scented litter in her box. The stale water sitting in that old bowl. These aren't small things. They're the difference between a cat that lives to 15 with good health and a cat that gets kidney disease at 10. Start today. Just one change. Better food, a water fountain, dust-free litter. Pick one, fix it. Then move on to the next one. Your cat doesn't have a voice in medical decisions. She can't tell you what she needs. But you can learn. You can listen to what the science says. And you can make the choices that actually protect her kidneys instead of slowly destroying them. Because a healthy cat is a happy cat, and that's what you really want anyway.